You've seen the logo, Be Nice. It can be as simple as that, but it means so much more. Behind the glowing green words is an action plan to notice, invite, challenge, and empower. Let's talk about the first step, notice. What can you notice about someone? Start by noticing what is right and what is good about someone. So then you can notice when something is different about the way that person is thinking, acting, and feeling.
It's not uncommon for someone to have a bad day or even a bad week.
But it's time to be concerned if you notice a change lasting 2 weeks or longer.
When it comes to family members, friends, and coworkers, you're someone who is most likely to notice changes, and by simply noticing a difference, you can make a difference.
What kind of changes are we talking about? Notice behavioral changes.
Someone who once loved a sport or hobby has quit playing or doing that thing. This person is isolating themselves from their normal friend group.
This person is avoiding social interactions with others. This person keeps their head down in the hallways when they used to smile and say hello to their peers.
They've started using drugs or alcohol as a means to cope.
They cry frequently for no reason.
They're neglecting responsibilities.
They've lost motivation.
Notice physical changes.
This person is no longer taking care of their appearance or hygiene.
They are fatigued and lack energy.
They're sleeping too much or too little.
They're overeating or had a loss in appetite.
They've gained or lost weight.
Headaches are frequent.
Maybe they have unexplained aches or pains.
Notice psychological changes.
Are they acting out or becoming aggressive when others confront them or ask them about their life?
Are they quick to anger over small details or happenings, or have frequent mood swings?
Has their level of sadness, guilt, pessimism, or indecisiveness increased?
Do they lack emotional responsiveness?
Do they criticize themselves frequently?
Maybe they feel hopeless, lonely, and sad, but they're not sure why.
Do they have thoughts of death or suicide?
These are the changes that could be a sign of depression. Being someone who notices can mean being someone who saves a life. Let's go over the basics. Notice how people are being treated and treating others. Notice what is right, what is good, and what is different about someone. If you notice these things about a person, it's easier to notice when they have a change in behavior or personality. If you notice someone you know is experiencing these symptoms, they could be depressed. If these signs or symptoms go unnoticed, it could lead to suicidal thoughts, or in severe cases, death by suicide. Maybe you notice these symptoms within yourself. It is important to realize that half of all mental disorders begin by the age of 14, and 3/4 begin by the age of 24. Now that you're ready to notice, the next step is to invite. You've noticed a change in someone or yourself lasting 2 weeks or longer. So what do you do next? The invite step of the Be Nice action plan involves taking a risk and reaching out. Sounds a little intimidating, but don't let that stop you. We're going to tell you how to have a simple, caring conversation.
Start by inviting yourself to tell the individual you are concerned using an I statement.
Can we talk? I've noticed that you haven't been acting like yourself, and I'm really worried about you.
Once you've initiated the conversation, give them a chance to open up and invite yourself to listen non-judgmentally. Being a good listener is important. Make sure you remember to
Be patient.
It's okay for there to be silence. Be comfortable with it.
Be consistent.
Be aware of your body language. Use comfortable eye contact and open posture.
Be understanding. Empathy is key.
Be an active listener.
Be honest. It's okay to say, I don't know all of the answers, but let's figure them out together.
invite yourself or that person to take a mental health screening on our website. This is a great tool for anyone who thinks they may be experiencing signs or symptoms. The results of these screens are not conclusive, but they can be a good start to finding answers. It's important that you consult with your doctor or healthcare provider.
You can also invite yourself to make a change in your workplace or community to create a healthier environment for someone struggling with their mental health.
Is there already a particular group or program at your school or workplace who can help you implement change?
Invite yourself to be aware of your surroundings. Are there professionals in place to aid your call?
Let's go over the invite basics one more time.
Invite yourself to start a conversation or make change.
After you initiate a conversation, be a good listener.
This person is opening up to you because they trust you, or perhaps you're the first person to notice them.
You're halfway through understanding the Be Nice action plan. Next up is challenging the stigma and challenging yourself to ask the tough questions. You know what to notice and how to invite. Now we're going to talk about challenge. The challenge step takes on a few different meanings. Challenge yourself to talk openly about mental health the same way you would talk about physical health. This will challenge the stigma surrounding mental illness. Challenge yourself or a person of concern to seek help. And perhaps the biggest challenge yourself to ask someone showing warning signs if they're thinking about killing themselves.
If someone is away from work in the hospital for pneumonia, you would show concern. Maybe you'd send a get well soon card or visit them.
This doesn't have to be different if someone is away being treated for a mental illness.
They need support and to feel hope, just like someone struggling with a physical illness.
Being afraid to talk openly about mental health creates a stigma around the topic.
The number one reason someone struggling with their mental health won't seek help is because they're afraid of what other people will say or think about them.
Just like physical illnesses, mental illnesses range from mild to moderate to severe.
If we can prevent people from reaching severe levels of depression, we can prevent suicide.
Mythbuster, it's never too late to seek treatment. Mental illness is 100% treatable and manageable.
So what kind of treatment are we talking about? It is important to know that treatment is not a one-size-fits-all situation. Here are some types of professional help.
Talk therapy is a great place to start.
If that's not effective, you may need to consider trying medication.
You might even need both, and that's okay.
Just know it might take a few tries to figure out what is best for you.
Who are the professionals who can get you the help you need?
Doctors or primary care physicians,
Psychiatrists,
Social workers, counselors, and other mental health professionals.
Certified peer specialists.
An early diagnosis and treatment can result in accelerated recovery, and the brain is protected from further damage related to the course of mental illness. The next challenge step is definitely a challenge, but so important. Maybe you've heard someone make comments like,
The world would be better off without me.
I wish I was dead.
Everyone would be happier if I wasn't around.
would you come to my funeral if I died?
I just can't do this anymore.
These are not just a cry for attention. These could be serious thoughts that lead to suicide.
Don't miss the opportunity to save a life.
9 out of 10 times when someone dies by suicide, they had an illness called depression. Ask them, are you thinking about killing yourself?
Mythbuster. You won't put the idea of suicide in someone's head by asking them about it.
Do not try to argue someone out of suicide. Tell them you care and that they are not alone. Most importantly, they can get help.
You can make a difference. Be the reason someone reaches out for help.
Find out why someone is hesitant to ask for help. Address fears of embarrassment or shame.
People often feel lonely when dealing with an illness. Staying by their side through the process is a great way to show someone you care.
If someone had a broken arm, you wouldn't tell them to just get over it.
Just like someone with depression can't just be happy.
Think before you say something that could increase stigma.
All right, we made it through N, I, and C. Now for the final step in the Be Nice action plan, empower. The final step of the Be Nice action plan is to empower. This word leaves everyone who is putting it into action feeling good about themselves. By empowering others, you empower yourself. And by empowering yourself, you might encourage others to do the same. It's a ripple effect of positivity. And this piece is key to saving lives.
By definition, empower means to
Give someone the authority or power to do something, or make someone stronger and more confident, especially in controlling their life and claiming their rights.
Empower yourself with the knowledge that you can have an effect on how someone thinks, acts, and feels.
Empower yourself by identifying your protective factors.
Find out what services are available to you and utilize them when needed.
Get involved in activities and groups at or outside of school, work, and the community.
Surround yourself with supportive family members, friends, and coworkers.
Have self-awareness.
Do you have strong morals or positive role models?
Having faith or spirituality can help.
So can a positive attitude and optimism or maintaining good boundaries.
Do you have good problem-solving skills or conflict resolution skills?
You can be someone's protective factor.
Discover your coping skills. You might already have some in place and you don't even realize it. Coping skills include
Listening to or playing music.
Cooking.
Playing a sport or game.
Taking time to disconnect and enjoy the outdoors.
Keeping a journal or blog.
Meditation, breathing exercises, or prayer.
Reading a book.
Spending time with loved ones.
Watching a favorite TV show.
empower yourself with resources. Here are some basic options you can have on hand for someone who is struggling.
Hotline numbers like the Suicide Prevention Lifeline.
Or the crisis text line.
Contact information for providers such as TCM Counseling, Pine Rest, Forest View, or Network 180.
On-site counselors.
Faith leaders.
Peer or parent support groups.
And organizations or websites like the Mental Health Foundation.
Your voice and actions can create mental health awareness.
Empower yourself or others daily by implementing the Be Nice action plan into your routine. Take time to notice others. Invite yourself to step out of your comfort zone. Challenge yourself to realize your mental health is just as important as your physical health. And empower yourself by recognizing what is right and what is good in your life, and how you can keep your mental health intact with effective resources, protective factors, and coping skills. Take it one step further and take the pledge to be nice in your community on our website, benice.org.